My name is António Guerreiro, and I am full professor of internal medicine at Nova Medical School in Lisbon. For many years, I have been paying special attention to problems related to malnutrition, in particular undernutrition. And hospital malnutrition is a huge problem. The factors that contributing to malnutrition are several, but the main problems are personal problems and organizational problems. Concerning personal problems, you know that in wards, mainly wards of internal medicine, you have old people with many diseases and also submitted to a lot of treatments. Concerning the organizational problems, I would like to show some examples, such as failure to recognize malnutrition, confusion regarding nutritional responsibility, and I would like to stress one factor that is the last factor, the importance of nutrition unrecognized. I would say that nutrition related problems in hospitals are not usually considered a priority. And you know very well that a well-established nutritional structure in hospitals means increased quality of nutritional care. I work in a hospital in Lisbon, is an hospital center, is the University Hospital Center of Central Lisbon. And during the last 11 years, I was head of a department of internal medicine in this hospital center. This center has 8 departments of internal medicine. You can see here that you have 4 general hospitals, this one, this one, this one, and this one, and a maternity and a pediatric hospital. My hospital is a hospital of Santa Marta, where I have my department of internal medicine. When I start functions in my department at the hospital of Santa Marta, I start preparing the implementation of a nutritional intervention algorithm. This algorithm was very important for us because you tried to screen malnutrition in all patients that were admitted and in patients that had risk, the patients that were submitted to nutritional assessment. And after this, all our patients were submitted to individualized nutritional support. I must stress that strongly that the inclusion of nutritionists in the internal medicine department was decisive. The nutritionist was in permanent daily contact with the remaining staff of the department, mainly doctors and nurses. This integration was an informal integration, but it does not exist in most of the remaining center. This experience was very, very important for us, was very rewarding. So you decided to try to extend it to the entire hospital center. In this center, you started by 2017 you started to prepare a proposal to the board of directors. You agree that organization improvement recommended by EXPAN makes the difference. As you can see, according to EXPAN guidelines, you have organizational forms related with food policy and with clinical nutrition policy. In our opinion, it is important to manage separately food and clinical nutrition policies. And so, for about 3 years, you have a new food policy according to EXPAN guidelines adapted to local reality. Concerning clinical nutrition policy, you have the same situation, and you can see the several structures and adapt to local reality. And in July 2018, the board of directors promoted and created these structures. It was very important, this coordinating committee of clinical nutrition. This is a central committee, and in each hospital you have a committee that is correlated with this one. You have an internal regulation, we have a strategic plan, a general strategic plan, and also individual strategic plans. Concerning human resources, the central committee has a doctor coordinator, 6 doctors, 1 from pediatric area, 3 nutritionists, 1 from pediatric area, 1 nurse, 1 pharmacist, and 1 external consultant. In each hospital, you have a local committee, and its basic structure is composed by a doctor, coordinator, 1 doctor, 1 nutritionist, 1 nurse, and 1 pharmacist. The strategic plan has a framework, a mission, intervention areas, strategic objectives, indicators, and results. And it's very important, our structure, because the Ministry of Health in July 2018 created, decided to implement the nutritional index risk, the implementation of the nutritional index risk in all country. It was mandatory from 2018 to do this. But for this implementation, but to achieve this goal, it was necessary to start by carrying out a pilot project with the aim of optimizing its operability. Due to the organizational structure already existing in our center, you were invited by the Minister of Health. So you participated in the pilot project to optimize measures related to nutritional risk identification in conjunction with the Ministry of Health, already carried out. You also participated, beyond this activity, you also participated in research groups in the areas of sarcopenia and fragility. In the beginning, you also began the implementation of the nutrition risk identification in our center in a comprehensive way, now delayed by COVID infection. We wanted to train our personnel about nutrition risk index and its importance in the implementation of the nutritional care process in April 2020, but this situation was delayed by COVID infection. And finally, you would like also to train our personnel on the nutrition care process, not done yet because of the COVID infection. Because our big goal, our big goal is to implement in the hospital center the nutritional care process. We want that our patients have to be screened when they are admitted. After screening, if they are in risk, they have to be assessed from a nutritional point of view. They have to have a diagnosis, the nutrition diagnosis, and a nutrition intervention. After nutrition intervention, the monitorization, they must be monitorized, and at the moment of the discharge, they have to have a plan of discharge. So, in my opinion, from the point of view of organization, there are a lot of possibilities to get better, because no doubt you still have many problems in this area.